Personalization. Personalization is a very important pillar of the Wizdom system because medical cannabis is personalized. For example, we have two breast cancer patients. They have different journeys, but the same goal of healing. One of them goes through chemotherapy and radiotherapy. Okay? They need supportive care to manage the side effects, to build the strength, to recover, while the other patient goes through surgery. Their goal is to remove the cancer and go back to life as fast as possible. We don't expect them to have the same treatment. We don't expect them to have the same protocol because they have different goals and different regimes that they're going to go through in order to treat this cancer. So even though they're both, let's say, the same age, the same type of cancer, they just chose different paths of how to deal with it. And for us as medical cannabis coaches, even if both of them have been administered or prescribed medical cannabis, we need to know how to help them. So with a chemotherapy and radiotherapy patient, we are most probably going to go through their goals and their expectations, both of the chemotherapy duration and then afterwards on the onboarding back to life, hopefully. And that's going to include a period of time that they're going to wish to be more sedated. And it's going to go through a period of time that they're going to be worried about eating and about having appetite or nausea. And it's going to go through problems of sleeping because of the pains and the side effects of radiotherapy and chemotherapy. And we're going to treat it as such. While the other patient, the one that goes through surgery, yes, she's going to go through pains. And yes, she's going to go through a physical recovery, but that's going to be a period of time. And then we're going to put her on a maintenance just to keep her cancer free. We don't want the cancer to come back. So for a period of time, we'll make her probably, because her goals are probably to go back to life as fast as possible, we're not going to give her any kind of sedating strains or means of consumption. We're going to give her more uplifting, energizing strains for the day, something sedative for the night to sleep well through maybe the pains or the hurdles of the surgery, something to increase and elevate the mood because she wants to go back into living life immediately. And those will be definitely, by definition, different strains. So, two similar patients, different routes of administration or different routes of finding their solution. One goes through medication, one goes through surgery. Obviously, the medical cannabis treatment will be different. Now, as we said, same prescription, different protocol. Another example, two Crohn's disease patients, very different patients because of the placement of the Crohn's. It doesn't matter if it's a male or a female. Doesn't matter if it's two males or two females. Doesn't matter if we hear and read everything similar in their medical files, but one of them has it at the edge of the colon, and one of them has it at the ileum, which is the connection of the colon with the small intestine. They both suffer from Crohn's right now. Officially, they have the same exact symptoms and the same exact sickness and the same exact indication. But for the one that the Crohn's is very close to the end of the colon, it would be much better and much simpler and much more direct to treat with a suppository. Yes, we might add some other means of consumption for the overall medical benefits, but directly to treat the Crohn's would be much easier with a suppository in this case. Whereas for the other patient, for example, where it's in the ileum, in the connection between the small and large intestine, A suppository will not go as far. It's local treatment. Yes, it will be absorbed in the bloodstream, and yes, the absorption in the bloodstream through the colon is high, but it won't be as localized and as direct as for the other patients. So we might recommend smoking, usually for Crohn's patients, unfortunately, in higher doses, either vaporizing or smoking, depending on specifically the patient. And we're going to look at the systemic effect and getting him to remission in another way. So even if it's the same indication, as we can see, it's different means and it's going to be different routes. And even though we have the same goal for those Crohn patients, for example, and they're both going through the same indications, apart from medical cannabis, the medical cannabis treatment is going to be completely different. We need to match the person, not the diagnosis.